Hi and welcome back. I'm Gila Marto, and we're now traveling to the other side of the world in terms of the collaboration in brain research. We have our guest, Stephen Schwartz, welcome. Stephen is the International Director of Research Development at the Herzog Hospital, which is in Jerusalem, Israel. And welcome. And you were watching us speak to Tim Patterson, who is would you consider him your counterpart in Canada, or do you communicate a lot?
We communicate by video conference.
Okay.
Once a month.
Wonderful.
And we talk about all kinds of interesting things because he and I are not the professionals that handle the interaction between the doctors. That's the case study between the doctors. We're the ones who set up the program, coordinate it to make sure that 8 o'clock Toronto time, 3 o'clock Israel time, everybody's sitting in their places.
Right.
You know, we're like the producers.
Right, with the technical team. Are there IT teams that are available to set all this up?
Tim, in his own right, is an entire IT team. Okay, you know, from A to Z. And we have our IT people back in Israel. But you know, in your conversation earlier, you brought up a point that I travel around the world talking about healthcare. And it was fascinating what you were discussing about Alzheimer's, and I just want your audience to be aware that health is not just a question of how do you treat illness. The World Health Organization, the WHO, okay, their policy statement defines health as a state of complete physical and mental and social well-being, and not merely the absence of disease or infirmity. That means everything from physical to mental to spiritual.
And emotional.
Exactly. So the point is that, you know, I like to say, especially in the case of neurological behavioral problems, 65% of Alzheimer's is misdiagnosed. Because the doctors in the world, that's why the collaboration with Baycrest is fantastic. Because it turns out our Dr. Kaufman spent 2 years at Baycrest as part of a fellowship. So he works with his colleagues, Dr. Cohen and Dr. Friedman, and behavioral neurology is exactly what it means. It's behavioral neurology. Now, Alzheimer's is both a physical problem and a behavioral problem. 90% of the doctors in the world either know it as a physical problem, as we heard plaque on the brain or whatever, or, like you were saying earlier, well, it's behavioral because I forgot something. It's the combination.
When you say 65% are misdiagnosed,
because doctors are not trained to diagnose it. I'll give
but
you an example.
Patients are told they have Alzheimer's when they don't, or they're told that they don't have it when they do?
I'll give you an example at Herzog. I mean, one of the things about Baycrest and Herzog that are very similar is we combine mental health and geriatrics. Most hospitals in the world are either psychiatric or mental health. So you have a situation, and this is a story I tell all the time. A patient was admitted to us from a 75-year-old woman from another hospital in Israel for 2 weeks, screaming, ranting, raving, Alzheimer's behavior. Okay. We did a series of tests on her, and we discovered this woman did not have Alzheimer's, but she was 75 years old. She was screaming. She was carrying on. That's Alzheimer's, right?
Her behavior indicated Alzheimer's.
They found out she had a thyroid problem, a urinary tract infection, and a vitamin deficiency. That 75-year-old woman who had the Alzheimer's label put on her, which meant, okay, let's treat her for Alzheimer's, and she would deteriorate and the rest of her life would be that way. In 2 weeks, walked out of the hospital as a totally healthy 75-year-old woman who to this day volunteers twice a week in the ward where she was supposed to be hospitalized at Herzog.
But that's so often the problem with healthcare is that there are so many healthcare professionals who they want it to be paid by numbers. They want to take something and say symptom, 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 therefore it's this. And we've all met those type of healthcare workers. And it's unfortunate because once you get labeled, even a child in school, once that child has a label on them, you know, they almost have to switch schools because once you're labeled, you have a real hard time taking that label off.
So it sounds like Herzog Hospital thinks outside of the box and ascribes to the WHO philosophy, which is, you know, more of a global reading of someone's general health.
Correct.
And you know, you mentioned one of the indicators of health is spirituality or their spiritual health. So I know that in Herzog they're doing some phenomenal studies or research with how spirituality dovetails with. Can you explain that?
Okay. This was a joint Baycrest-Herzog project. We were the first ones that were published in any medical journal that showed the level of a person's spirituality, not religious observance, spirituality. Okay, you could be the most agnostic person in the world, but if you have some spiritual, okay, in the neurology journal, this was 4 years ago, which is one of the most preeminent international journals on neurology, we showed that the level of a person's spirituality slows down the advance of Alzheimer's. Okay, in other words, you believe in something else. And it's not just hospital chaplaincy.
Well, your life has meaning, and this is so important. There was recently some research done on kids in their 20s who are perfectly healthy, and we're not talking mental health disorders, but they can't seem to stick with a career path, a job, or education, or anything. And the counterpart of it was followed, I felt, closely after with an article saying if your life doesn't have meaning, if you don't feel that you have a purpose in life, you don't feel a part of not necessarily a religious community, but some kind of identified community and some goal, that people just drift.
Well, you
and the same thing with geriatrics. They have to feel involved and have purpose.
It's across the board, but you mentioned before about, you know, finance and doctors looking at the numbers and you chart it. Okay? At Herzog, we treat the patient in a holistic way. In other words, the patient comes into us for hypertension. We don't just treat them for hypertension and say, okay, bye. We look at the whole person. So if that person has hypertension and depression and 3 or 4 other things, we just say, okay, you came in under code X. We'll treat you for that. Goodbye, we got paid for it. And it's the same thing with Baycrest. And then there are very few hospitals in the world that have this philosophy of care because financial and holistic, they don't even go in the same sentence.
Right.
It's funny, Herzog Hospital is world-renowned, and the proof of that is all the different organizations and medical institutions that you're involved with. For example, and also non-medical institutions, for example, Rotary Club. Can you explain that one?
Okay. I like to say that medicine is not non-sectarian. We do a lot of research by us. And, for example, we just discovered, because Herzog Hospital was established in 1894. And then it was the first psychiatric hospital in the entire Middle East. Today, we're the foremost geriatric and psychiatric hospital in Israel. And there are very few hospitals in the world that combine geriatrics and psychiatry. If you're a 30-year-old hospitalized psychiatric patient, and now you're 70, that's a different profile, but you still have to be treated. So we've done a lot of research, and we recently received a patent from the European Union because we did some research using glycine, which is an amino acid, a natural protein in the body, not a fancy pill that some pharmaceutical company made. And one of the side effects of schizophrenia is Parkinsonian trembling. So we use this glycine to treat other problems from what's called dopamine. That's how you treat schizophrenia. And we found the glycine helps the schizophrenic patient, but also reduces the Parkinsonian trembling. So because we're also a geriatric hospital, we said, hey, you know what? Let's try the glycine on the Parkinson's patients. The European Union, the FDA in the States gave us patents, and now we're negotiating with pharmaceutical companies saying, hey, wait a minute, you found a new way to treat Parkinsonian trembling, which, just like Alzheimer's, everybody's worried I'm going to forget things. When we see these poor, wonderful people who a year ago were fully functioning healthy people, and all of a sudden they're like this and they can't hold a cup of coffee, it hurts us. So we're finding tremendous results of doing clinical trials at the hospital. That brings me to Rotary.
The Rotary Club in Canada? Or
Rotary International.
International.
Okay, and again, this is, it's fascinating that you put Tim and I on the same show, because the more I verbalize projects, the more it says Herzog, Baycrest, Baycrest, Herzog. Peter Silverman is one of the funders of the telehealth program. Tim, in his wisdom, was able to get Rotary Canada involved. Now, Rotary does projects all over the world, water programs, polio programs, and so on and so forth. Rotary picked up on the fact that telehealth, because Rotary's international, is a way, just like he was describing the problem with the patient in British Columbia and so on, teleconferencing is a way to communicate and train people internationally. So we had the first video conference at Herzog, and one of my people in Jerusalem says, hey, I'm a Rotarian, and I see Rotary written on the program. Long story short, she activates Rotary in Jerusalem, which activates a Rotary Club in North Carolina. They wind up raising money for us to purchase the video conferencing equipment. A Rotary Club in Windsor, Ontario, okay, says, hey, you guys are doing video conferencing. Maybe we could help. We had several ideas, and Tim and I had a meeting, this goes back around 3 years ago, because we train Ethiopian women immigrants to be nurses' aides, which is a phenomenally successful program in Israel, because unfortunately the Ethiopian women come with no education. The Aliyah, the movement of Ethiopian Jews to Israel was, wow, it's fantastic. Once they got there...
Well, that's another story.
Okay. So we created a program where to date we've trained 200 Ethiopian women who had no high school diplomas, minimal academic skills, to become nurses' aides. And today these women who are cleaning people's houses and cleaning toilets are walking around with white nurses' uniforms, caring for patients, both geriatric, we also have a children's respiratory unit at the hospital, and it's a beautiful sight to see this petite little Ethiopian woman in her white nurse's uniform treating an 8-year-old kid who's hooked up to a respirator. I mean, okay, so when we're talking, okay, let's use Ethiopian nurses' aides to train Ethiopians. That didn't work out, but it turned out there was someone from the Windsor Rotary Club who's from Ghana, okay? And today we are about to launch, with the help of Rotary International, Rotary Windsor, and also the Canadian government's getting involved in it, distance learning in public health for hospitals in Ghana. And this is going to be a turnkey project that can be repeated anywhere in the world.
And it's all done by teleconferencing, the
Totally.
training, or you're not flying
Totally.
people back and
Nope.
forth?
No,
Well, that's, to me, the whole big cherry on top of all the projects, is that we need to have more collaborative efforts where, not just for an environmental aspect, but for the cost aspect, that, you know, we're still insisting on flying people halfway around the world to meetings, when we all know that a lot of these meetings could have been done by teleconferencing if people made the effort.
Beyond that, for example, we're having the first pilot is 10 hours of video conferencing with Ghana over a several-month period.
With doctors in Ghana, or
doctors and nurses in Ghana, and our people who are using the same curriculum we're using for the Ethiopians. For example, how to take someone from a wheelchair to a bed.
Okay.
Okay? You can do tremendous damage to an elderly, frail person if you do not know how to properly lift them from bed to wheelchair or wheelchair to bed. And it sounds simple, it sounds ludicrous, but, you know, all of us know someone who's had hip surgery, all right? And hip surgery went fantastic. But if they didn't do the proper physical therapy, the hip surgery is useless, and that person's going to be walking with a limp or a walker the rest of their lives. It's the same thing here. It's what happens after the fancy surgery. And at this point, we're very excited about it, because you can reach that many more people by video conference. You could put 200 people in the room every Thursday at 2 o'clock and train them on, today it's wheelchairs, tomorrow it's another aspect of public health.
So the teleconferencing with Baycrest, though, is more about training or more about treating actual patients or research?
Two separate things that are related.
Oh.
The video conferencing we have with Baycrest is a brilliant idea that puts together, because health is non-sectarian, right? Puts together people and doctors from all over the world to talk about, okay, we have a case study. I remember we just had something at Herzog where we were the point, because each video conference is another site is picked. Maybe it's a patient at Baycrest, maybe it's a patient in Jordan, maybe it's a patient wherever. So we had a situation of a young man who was hooked up to a respirator. And what was the examples of him improving? Or better yet, we had, even before that, we had a woman who was a physiotherapist. And she slowly started losing her memory, so she couldn't function.
And this is at the Herzog?
This was at the Herzog. And we had a whole case study where the doctors at Herzog, the doctors at Irbid University in Jordan, were interviewing the patient and the doctors. It's usually done in English. In some cases, the patients can speak English on our end. If not, so they speak in Hebrew, and the doctors or someone translates. But it's a learning experience for the doctors to say, how do we look at this? And the subjects that the doctors pick, and they're all behavioral neurologists, which in and of itself is a profession that probably 15 years ago didn't exist. You were a neurologist, or you were a psychologist. Rarely went together. The Ghana program is simply training primarily for what I would define as nurses' aides on how to treat patients. It's not a case study of a patient. It's a much more broader impact.
I wanted to talk for a minute or ask you to explain a little bit about the Ontario-Israel Brain Research Initiative.
Okay. The next great plague for the world will not only be Alzheimer's disease, but everything related to it.
Because of the aging population.
Exactly. Okay. We've conducted research, and world research shows that 50% of people over the age of 85 will have some form of dementia or Alzheimer's. Now, again, there's 164 manifestations of dementia or Alzheimer's. Alzheimer's is only one manifestation of what they call dementia, or senile dementia. Now, in Herzog's case, because we're a mental health hospital, and because we work with post-traumatic stress disorder, and because we work with respiratory patients and geriatrics, what's the common denominator? The brain.
Right.
Okay? Now, if you look at the brain diseases, and I'm not talking about physical brain injury, I'm talking about
degenerative.
Like we today, science is such that you can do a CAT scan of the brain and show the cerebellum is foggy in an Alzheimer's patient.
Because of the plaques?
No,
No?
because it gets foggy. They haven't figured out what's causing it to get foggy, but it's not a clear cerebellum like
Okay.
the three of us theoretically have. we
Oh, I hope so.
Okay, so, you know, the whole concept of mind-body. Doctors never said it's body, there's no mind. Okay, you read early philosophy from 200 years ago. So today the science can say, okay, look at the brain, there's a problem there, we understand there's a physical problem, and there's also a psychological or a behavioral issue when the cerebellum gets foggy, if you will.
Well, I think people are starting to understand that better. And I remember there was a Harrison Ford movie where he got shot in the head and his entire personality
But that's
changed.
physical. That's physical.
But
That's a physical injury
it was
to
a
the brain.
physical injury. But I think people understand that now with senility, that entire personalities can change. People,
Absolutely.
and I think people used to have a hard time believing that they didn't want to believe themselves that we're just a bunch of cells and water and whatever we're made up of, that our personality isn't somehow predetermined and that we can change, that it's a fluid sort of thing.
I'll give you two examples. One has to we learned at one of the video conferences at Baycrest, and then I'll relate to your Brain Institute question. Okay, see?
I thought you were having a foggy moment.
I always have foggy moments, and I just go, shh, shh, shh. Okay, we had a video conference led by Baycrest by this phenomenal lady called Paula David, who's a social worker who specializes in Holocaust survivors. Right? And she described a situation of a daughter talking about her mother who was a Holocaust survivor. And her mother was always this tough, cold woman. Okay, that's the childhood she had with her mother, because she went through the camps. Okay, woman gets Alzheimer's at 80, forgets everything from after she was 10 years old when she went into the camps. All of a sudden, the mother becomes this happy, wonderful person who she never recognized. Okay, it's a tragic story with, I don't call it a happy ending, and so on. Brain Institute. About a year ago, the Ontario government and then Stephen Harper decided that research in the brain becomes important. So there are several now, what can I call them, policy movements here in this country, both Ontario Brain Institute,
Right.
okay, and there's a $100 million fund from the Canadian federal government for Alzheimer's or brain research.
So if I can just go further for a moment,
Yeah.
forgive me. So with regarding the federal government, it's a $100 million grant, and it's going to be expounded to $300 million, and it's historic for a federal government in Canada to position brain research at such a high level. And then provincially, I think it was last year, the McGuinty government took the step to acknowledge that there are 1 million people in Ontario with neurological problems, and there are 2.6 million Ontarians who will be affected by a neurological brain issue in their lifetime. And what they did is they established the new Brain Institute, and it's going to bring Ontario's top brain researchers together with top brain researchers from other hospitals across the world. So,
And you know what? We're going to have to wrap up for today, but
Okay.
we're going to have to meet again, and we're going to have to see what's happening, because this
One
is a
sentence?
whole lot. Sure, one
Yes,
sentence,
yes.
absolutely.
Concurrent with what she's saying,
Yeah.
Herzog Hospital just started an initiative to set up a massive brain and research and cognitive center to look at all of these problems, and we're already in discussions with our counterparts in the Ontario government and in the medical community here to collaborate and say, how do we work together to benefit the people, whether they be Canadians or Israelis?
Well, the word for the day is collaboration, because this is very,
It
very
is.
impressive and very historic, as Robin has just said. So thank you for tuning in. It's Gila and Guess, and we look forward to meeting with you again next week. Thanks.